Dennis, who I saw. Obviously, you do a lot of work for the charity, London Autism Group charity, already through adminning the Facebook group that the charity runs. So, just huge thanks to you for all the work and time that you put in to that. And I saw you. We want to talk to you today because you work in a primary care setting in a GP practice, and you're a nurse practitioner.
Yeah.
So you are sort of on the front lines at the moment of supporting and advising people when it comes to the awful COVID-19 crisis that we all find ourselves in. So we thought it would be a good idea to talk to you about sorts of things that people should be thinking about, and perhaps you sort of go through any kind of key points that you think the community need to be aware of and get clarified from your point of view. And in particular, anything related specifically useful for the autistic community and our, our autism community. But of course, that information that you'll give is going to be relevant to everybody, isn't it? Yeah,
Yes.
yeah, yeah. So first of all, would you mind just briefly, yeah, introducing yourself and expanding perhaps on what I've already said?
Yeah, absolutely. And thank you for having me, Chris.
Oh,
That's
you're
my
welcome.
first experience with the live stream, so let's see how it goes. Um, as you said, my name is Aysel Deniz, and I'm a trained practitioner, and I work in the primary care setting. And I will be dealing on a daily basis from children to elderly, usually treat a chronic disease and help them to manage their condition. That was 3 weeks ago. Right now, all about COVID-19, and we're trying to do our best to help the public as much as we can. So I'm a mother and I have two children. My oldest one is 15-year-old. She's neurotypical. And my 12-year-old is autistic. And so I'm quite familiar with the problems at the moment our community is facing, because I'm facing exactly the same thing at home. Our son is quite reserved. He is verbal, but he doesn't like social interactions. So this COVID-19 and lockdown situation, it was very welcome by him because he really doesn't like socializing with people.
Right, right.
But I think not going to school, he it threw him out of context, because that's the normality he knew. Everybody in the morning gets up, breakfast, and we go to work, he goes to school. That has changed. And all of us at home, I still go to work every day, and my children and my husband is at home, and they're trying to adjust and trying to work from home. And there's a lot of issues that is not enough time for me to tell you all, but everybody is facing. So what I wanted to do today, touch some of the question I do get from the general public where I work and the people register with us, because there are a lot of confusion and the conflict information we are receiving from the government, and it seems to be the information what is being said in the news is not getting to the people who should have. So I'm going to talk about it. Everything I say here, it's going to be specifically to my practice, but it's a model practice. So in North London, so it's going to be very similar service will be running. At
Yeah.
the moment, due to staff illnesses and some family member of the staff had to be isolated and not being able to test, and we don't know who has coronavirus, who hasn't. So we took some measures. So we are still accessible. People can still call us. People can still speak to us. We increase the capacity of video consultation, and we are trying to get to everybody who needs us. At the moment, something called Barnet Federation, where I'm located, it's come up is two clinic. One is called hot clinic, one is called cold clinic. what it means that anybody, obviously, COVID-19 is here, but people's diseases hasn't stopped. We still need to carry on with our care,
Mm,
continued care. So this hot clinic will be for people who ill, needs a medical care, but not COVID-19 related. And
mm,
the cold clinic will be something that you will need day to day, like getting your immunization, getting your some of the injection or dressings or any other issues that you will normally go to your GP for. The reason they separate this clinic because they trying to make sure that there is not massive crowd in the hospitals or the clinic is being set up where the venues are. Unfortunately, I can't tell you where it's going to be. I know it is going to start from next Monday, but we're still waiting for the health and safety approval to go through. So that's is, and what else I can talk about it. So I'm going to have to look at my notes because I write so many things that I want to give what is needed to be said. But please stop me if
yeah,
anything
please. Yeah.
to clarify. Yeah,
Yeah, go for it.
I think there is two issues with confusion about who should be isolated and who should be extremely vulnerable. So when the government announced saying some people shouldn't leave home strictly for 12 weeks, that created quite a bit of confusion in the general public. What is actually we saying? If you feel that you're at risk for any reason, doesn't matter whether you receive a letter as shielding or not, you should be shielding yourself. If there was any way that someone can bring you food, someone can carry on and helping you, and you don't need to go out, please don't go out. That simple as that. And about exercising, going out, because there are some rules is being quite relaxed because people not being told not to go out, people being told isolated and practice the social distancing. But in reality, if it's not essential, it is safe to stay at home.
Mm,
And that will be including your close family who is not living in your household.
mm,
So the only way, because we don't know many things about coronavirus, but what we know, it spreads through person to person. So the virus need a host contact, a human, to survive. So if we keep moving, it's almost imagine someone wants to stay home and asking for lift hijack, and then if the cars are moving, that person will get on board. If no cars are going, and obviously this virus is not going to carry on.
right.
So yeah, that's the whole point, because I think we should all focus on what we know rather than what we don't know. Many people wondering how long it's going to be. Am I going to be able to carry on my normal life 6 months time? Will I have some long-term effect if I get coronavirus? Those are unfortunately is not very clear, because this, as everybody knows, is coronavirus started. Well, we started to know is middle of November. Started from China, so a lot of evidence is there, but is not being collected. So we don't really know what is the effect, and we know the extremely vulnerable people who will simply need a flu jab yearly will be there. It's like people who has cancer treatment, people are taking certain medication that makes them vulnerable, people who had an organ transplant. Those are definitely should completely isolated and not have any face-to-face contact.
Mm,
Does it
yeah.
make sense?
Yeah, absolutely. Yeah, it does. Yeah.
Yeah. And I know we've been talking about so much, but the hand washing is the only effective actually thing we can do to stop this virus spreading. And most of the people ask me that, is it better to use alcohol gel or shall I wash my hand?
Mm.
We will prefer washing hand is first hand because it's more effective, and also the virus needs a oil fat they hold on to. So by washing your hands with the soap and warm water, you're actually removing the virus and is washing it out to the sink. The alcohol gel or hand sanitizer, it has to be at least 60% and more to be effective. And
60%
60% of alcohol, it needs to
in
be,
alcohol, right?
yeah.
Mm.
And because I've seen a lot of different hand sanitizers being distributed in the supermarket and so on. So is hand washing is more effective than hand sanitizing,
Right.
unless you don't have a water, you don't have access to water.
But presumably, though, it is only effective hand washing if you're washing your hands properly. If it's just a quick,
Absolutely.
right? Yeah.
And everybody knows about happy birthday and so on. So
Mm.
it is just the things you need to remember: the whole hands and including your wrist.
Ah, including the
Because,
wrist. Yeah.
yeah, and I
Mm.
would strongly advise people not to wear jewelries these days, like rings and watch, because the virus actually hides this kind of hard surfaces.
Mm.
So
What
it's better
about?
to wear it. Yeah.
Oh, that's a good. That's I didn't realize that. That's a
Yeah.
really interesting point. So no rings or watches, ideally.
Well, ideally, yes.
Ideally,
Unless you're
right? Right.
absolutely sure that you can take your rings off and then you can wash every time you wash your hand
Mm.
inside and out, then yes.
Mm. What about mobile phones? I mean, I've wondered myself a lot about transmission from holding a mobile phone and then your hand coming into contact with your face or whatever
I'm
wherever is
glad
it.
you brought it up because that's one of the things we keep saying that it is essential, because you're not going to be able to wash your mobile phone. So wherever is possible, it's better to use the headset or something that is away from your mouth, because unfortunately in this DNA everybody carries their phone. We like to take a picture, we like to send, we like to connect with our family, which is quite natural. And I would strongly advise people to keep communication open, but if it's possible, and use headphones, and then make sure your phone is somewhere in your pocket rather than in your hand.
Right, right, okay. um
And very small thing about hand washing is you really need to put the soap first. I know it sounds like very obvious, but I just wanted to clarify this, because if you wet your hand first, water can act like a barrier between the soap and your hand.
oh, right, I did not know
So
that.
yeah,
Right.
it's better to
Wow.
put soap and then wash your hands.
It's a
We
bit
all know what happened to the politician who didn't wash their hands. I'm not gonna name.
it's a bit it's a bit disconcerting in a way that hand washing is so difficult to get right, and there's a lot of variables. It takes a lot of thinking. Isn't as sort of obvious and simple as you might think, is it? As you said, that making sure that you put the soap on first. A lot of people probably don't know that. The fact that you have to do it very rigorously. You might not think that. I think use hot water as well is
Warm
recommended.
water, yes. Warm
Yeah, warm
water,
water.
yes.
And then I saw this video I saw
Yeah.
on YouTube, or no, it was an NHS promoted video, and they showed this lady using this kind of black, like ink that spread around her hands purposely. And the idea is that if you wash your hands properly and you kind of move your fingers and hands around properly, that you can get. Well, the aim is to get all of that black ink spread across in all of the areas of your hands. But actually, it takes a lot of doing because you have to do each finger, and it's, I
Okay.
think for most people, just doing it like that, it's not going to work.
Just yeah.
No.
Well, I'm a bit lucky in that sense because I have to wash my hands no matter whether COVID-19 is here or not, because it's part of the infection control. And also, our son loves seeing the steps by steps. So I actually print one of the NHS hand washing little chart that he likes looking at it, step one, step two. So we've been doing it anyway. So it wasn't very difficult for us in household, because every sink we have in the house has that little. And I'm going to suggest everyone to do that, because if you look, you will do it properly.
Yeah. Okay. Great. And I'm curious as to if you've heard about the NHS getting testing and anything on that front. Like, are you in the primary care settings going to be tested? Are you going to be? Is that going to be rolled out soon? Or any
Okay.
news on that front?
Chris, whatever the public is hearing, we're hearing the same thing. We're not
Mm,
getting anything different than the general public.
mm,
But we know even the local hospital hasn't had the testing yet. So there's a lot of consultants that I am in contact. They've been self-isolated because it's the first rule that do not harm the patient. If you are carrying the virus, it's going to spread to everybody else. So it's really, really essential. This test has to come and then needs to be done.
mm,
But there is nothing that we heard. And I'm going to touch the PPE as well. Then we don't have the right equipment still. That is why at the moment the face-to-face consultations are very limited, because it's all about protecting the public.
mm. Interesting. Um, so, what are your thoughts, Isel? As an expert in this sort of area, on where this is going, in terms of progression, that kind of curve flattening. Now, how long do you think this is going to take if
Well,
people?
in my humble opinion, I'm not an expert on this, but we think this is going to last maybe September, October. I don't,
Really?
yeah, because if we can carry on this self-distancing and self-isolation, it's definitely going to help. Because
Mm,
although we know the numbers are growing and unfortunately some people lost their life, but we know since the 23rd of March, since the government announced these new bans and rules about going out, the new cases are less compared to what's expected, compared to other countries who already had the coronavirus. But I don't
mm,
expect my children to go to school at all until September. And maybe, I think, until the last coronavirus cases is being completely um, isolated, then we will have to carry on doing these extra measures.
mm. Okay.
And I know this is not what people want to hear, but I'm going to say something about the autism community. Although it seems to be a really, really difficult time, but we already know what difficult time means for us, because not like the neurotypical people, we have to adjust our lifestyle so much, because our loved ones, autistic community, autistic society already has a lot of challenges going on and so on. So I have every faith in all the parents sitting there watching us. They've done this so many times. They come out really standing up, chin up, and all over again. And sometimes people might feel that they can't do this anymore, it's too much. But I know next day when they wake up, they're going to start all over again and they're going to do their extreme best.
Yeah. Resilience is such a big factor in this, isn't it? Because
Absolutely.
it is a very stressful, difficult time. We talked about this a bit with Lola in the previous live stream about how we might sort of boost mental sort of energy and resilience.
Hi, Darren.
Hi, Daryl. So yeah, it is a big factor. I think hope is a big factor, isn't it? If you're,
Absolutely. And
mm,
the
mm,
communication. This is what you're doing is brilliant. So I'm just gonna say, you know what? If you're feeling lonely, if you're feeling that it's too much, pick up the phone. If you don't want anyone to know what you're going through, or you want anonymous, London Autism Group is there. You can always post, or you can tell the admin saying, I don't want my name to be announced, but can you please post this for me? We will never judge. We will always be there, because don't forget, we all in this together. And I really, really mean it.
yeah, I fully agree. Fully agree. Thank you for saying that. I wanted to ask you one more question specifically about the primary care setting. how is it? How does it communicate with the other sectors? You know, with the sort of A&E and you know, sort of emergency sectors. Is there
Okay.
sort of joint working, joint communication? What kind of? How does it sort of all tie in?
Okay, for many, many, many years, we've been fighting for this to say that we should be able to communicate each other about patient. Patient shouldn't come to us saying, "Oh, my consultant said so." We should know this when they come in front of us, so we should know in advance. But one thing maybe is good about this crisis that we've been given very quick access that people can actually see the certain things about your medical record, not everything, so the confidentiality is still there, it's not being breached. But if you need urgent medical care, the key people like the ambulance service will be able to access the certain things. If, for example, if you're on a certain drugs and you immunosuppress, they will be able to see it. Hospice and some of the key consultants will see the record, but not every member of the NHS workers. But I think this is going to be good because it will be like one-handed. You don't need to carry any paperwork with you. So the key things we will be able to know. And I was mentioning before about Barnet Federation, because we know many GP surgery was already done stuff because people are ill or they don't have any capacity or they don't have the expertise. We all get together. So we will be able to see anybody's patient when these clinics are open. It will be for all Barnet residents, not just where you register for your GP. But to be able to make an appointment, you still need to contact your own GP's receptions and they will be able to make appointment face to face or telephone appointment for you.
Okay, right.
And
Um, mm.
yeah, please, yeah.
I just wanted to ask one last thing from my side. I don't know if James has got any questions, but one thing I wonder about and I worry about is the sort of staff morale. You know, it must be very draining for everybody involved. You know, in all sort of sides of this, including primary care. What is your view of sort of perception of staff morale? You know, being someone that's working in this clinic, every day and sort of it being right in there. How are staff coping? And are there any kind of particular sort of desires or concerns or issues that staff you think have that need dealing with?
Well, it should come to surprise to you, but we all actually train to do this scenario. So we don't have the real threat. We have specific training to prepare us for this. So we're ready and we are there for anybody who needs us. There are some barriers and I'm hoping it will be overcome. Like as soon as we know who had the coronavirus, he can't pass to others and we will be able to fully function. That is a bit frustrating, but between all of us, we have a really good network going on and we have a lot of confidential groups. We don't share the patient's confidentiality, but we can share our experience. And then if something is working well, it could be like for relaxation technique, it could be something that's someone tried and get a good response, and then we can just share the information. So again, is communication, keeping the communication open and sharing your worries, telling someone that's how you're feeling. I think that's the key.
Okay.
But we are resilient. NHS will be overcome with this. I 100% certain about that.
Mm. Okay. When I was clapping the other day on the doorstep, I was thinking about you. I saw. I
Thank you
was
very much.
definitely
But
dedicating a few claps to you.
yeah, and I must address, and it's not just us, there's a lot of people behind the scene that you wouldn't know, like the person who carries the samples from our surgery, the person who brings our post, making sure the carers goes in. So I think it's everybody, even you guys at home, not going out, staying home is 100% help. I think we all doing our bits.
Yeah, yeah. Thank you, Isol. James, have you got any questions?
Um, I kind of like the charity is addre- trying to address the mental health of the autism community at the moment. But I was thinking, are there um, is there any support for NHS staff and their mental health at the moment?
Well, yes, there is, but we're too busy, so none of us can attend these courses. But we are doing a lot of digital training, and we all have our clinical supervision. So if we feel that it's too much, or you burn out, or you need a
Yeah,
break, that is available to you. So
yeah,
there's
that's
always someone behind you
mm,
who can fill your shoes.
that's what I was thinking of. You know, people burning out and things like that. And
Yeah.
That's a great question. I wonder whether after this all ends, there will be a higher degree of sort of trauma, and residual
I hope so.
mental
I
health.
hope so. Yeah. And also, I think it has to be reflection period, isn't it? To look back what we did well, what we didn't do well, and hopefully we will be prepared for the next event if there is any in the future, and we'll look
Mm,
back and learn from our mistakes and the good thing we did. Yeah.
yeah,
But
I
it will
agree.
pass. I think it will pass. We just have to keep doing what we're doing best.
Mm. Okay, well, that is really wonderful, insight and really useful information. And it's very reassuring that, you feel that this is working and, it is a matter of time. And, we're going to come through this. And, it's been really, really useful just sort of delving into that. And I do think it's important to just sort of bear in mind the well-being of the NHS staff, as James is highlighted. I do think we have to bear that in mind and look after you guys as well. It's not just about that you guys doing your job, but also your well-being. Your overall well-being being protected as much as possible under very difficult circumstances, so that you're able to effectively carry on.
And thank
So,
you, Chris and James. You're doing a great job. So it was been pleasure being here.
thanks for coming on. Thanks for coming on.
yeah, thank you
Um,
so much.
yeah, and if anybody listening to this on the recordings perhaps has any questions for ISIL, I'm sure we can pick those up and get back to you.
Yeah, absolutely.
All right. So our next recording is going to be on Friday night. Our next live stream, I should say, will be on Friday night at the same time of 8:30, and we're going to be talking to Robert White, the autistic comedian who was runner-up in Britain's Got Talent a couple of years ago, and that's going to be lots of fun. He's going to talk about mental health, autistic mental health, and perhaps try and cheer us all up, which is probably what we all need.
Looking forward. Yes.
Yeah, we're good. Yeah.
Okay.
So that's it from me. Thank you very much,
Thank you.
James.
Yeah, thank you. I saw the coming on. I think,
It's my pleasure. And
and
have
thank
a
you for
good week
thank
for.
thank you for all you're doing as well.
Yeah,
Thank you.
big thanks. All right, take care, everyone. Thanks. Speak to you soon.